The journey through a serious medical condition is never easy, but when the diagnosis is cancer, it can be downright harrowing. As a clinical psychologist and woman, I've personally known the deep pain of losing loved ones to cancer, and the challenges are surely intense. And for all the souls who have been through similar experiences, you know how taxing it can be, physically, mentally, and spiritually. Today, Andrea Wilson Woods, a renowned patient advocate, author, speaker, and founder of the nonprofit Blue Faery, will tell her story, increase our knowledge, and give us uplifting hope along the way. Today, we'll focus on this listener's real-life question. My mom was recently diagnosed with cancer, and I feel mad and overwhelmed. I'm not mad at her, but at the situation because I'm an only child and my dad was never in the picture. I don't know how to make time to give her the support she deserves, work, and care for myself. But really, what scares me most is losing her. She's my best friend. I can't fall to pieces because she needs me. Do you have any ideas that will help me stay strong? And with that question as the focus of today's episode, I'm Dr. Carla Manly, and this is Imperfect Love. Please note, as this episode contains sensitive information, listener discretion is advised. If you need special support, please see the special links in the show notes.
Welcome to Imperfect Love with Dr. Carla Manly, psychologist, author, and relationship expert. I'm here to help unravel mysteries and misconceptions about love, relationships, and mental health issues, plus everything in between. Love is complicated, people are imperfect, and relationships surely can be tough. Together, we'll navigate this messy, imperfect space of real life.
Today, I am joined by a delightful special guest, Andrea Wilson Woods. She is the founder of Blue Faery, the Adrienne Wilson Liver Cancer Association, and she's also the author of the award-winning book, Better Off Bald, A Life in 147 Days. Welcome to the podcast, Andrea. It's a delight to have you with us today.
Thank you for having me, Dr. Carla.
It's such a pleasure. So, before we launch into the topic of today's podcast, would you tell our listeners just a little bit about what makes you, you?
Sure. So, I am a sister, parent, friend, lover, daughter, and at my very core, I'm a storyteller. So, everything I do revolves around storytelling. Whether it's speaking or being a patient advocate, or even doing comedy, which I'm dabbling in, and writing. I just love telling stories and hearing other people's stories.
What a beautiful introduction to who you are. Thank you. You are surely a multifaceted human being. So before we get into the question of the day, if you don't mind sharing a little bit about the Blue Faery, what that is, what your nonprofit is all about, and gently nudge us into whatever parts you want to share about your journey and your story.
Sure. And that's an excellent question, by the way. I was mentally taking notes in my head. So, as you said, I'm the founder of Blue Faery, the Adrienne Wilson Liver Cancer Association. And Blue Faery's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, commonly known as HCC, through research, education, and advocacy. So we focus on the most common and most prevalent type of liver cancer. I started the organization in memory of my sister Adrienne. When I was 22 years old, my sister was 8, and she came to visit me in Los Angeles for what was supposed to be a 2-week Christmas vacation. And the day after Christmas, our mother called and said she didn't want to be a mother anymore. And I had kind of watched as my mother's life had unraveled. She was a drug addict, and she got caught shooting up morphine at work. She was a nurse, and she lost her nursing license. And I just saw the unraveling, and I was sending money home. And I told our mother that Christmas that if I took Adrienne, I wouldn't give her back because our mother was refusing to get help for her addiction. And so I got physical custody immediately and overnight became Adrienne's primary caregiver. And eventually I sued for legal custody and won. And I think I mentioned before we had different fathers. So her father died before Adrienne was born. So she didn't know him at all. So I was really the only family she had. And I raised her all through my 20s until she was diagnosed with stage 4 liver cancer 1 month after her 15th birthday.
Oh my goodness. Thank you for that background. I'm so sorry for everything you experienced. There's so many layers there. So you became a mother at
Yeah.
21, a mother of your sister's mother, 21.
Rather my sister, yes.
Yeah, your sister's mother. Yes. My goodness. And can you tell us a little bit more about before your sister was diagnosed with cancer, what that looked like for you as such a young mother fighting for custody of your sister?
Yeah, I mean, it was hard. It was a financial struggle. I in no way had my life together. I had my college degree, but that was it. And she had been living with me for about 5 months when we had this very pivotal, oh my goodness, moment in our relationship. I had taken her out for her birthday. She turned 9, and she lost her mind when the staff sang happy birthday to her. I mean, she turned into a 2-year-old, full on temper tantrum, screaming, yelling, kicking, hitting. It was
Oh my.
awful. I dragged her out of the restaurant and we went home and I said, that behavior is unacceptable. You can't do that. And she just starts screaming at me that she didn't want to live with me anymore and she wanted to go home. And, I couldn't tell her there was no one to go home to. I couldn't tell her that I was it. And in that moment, I really trusted my gut, which I always encourage caregivers to do. And I just called her bluff. So this was back in the day when you could call an airline, make a reservation, and they would hold it for 24 hours without payment, which is mind blowing when you think about it. So that's what I did. I called the airline right in front of her. I made it seem like she was on a flight out the next day. Mind you, I had no way of paying for that ticket, but the whole idea was just to, call the bluff. And then I went into the living room and I waited. And this was the hardest part, was to wait and not give in and hold my ground. And after an hour of yelling and throwing things around the room, she came out and she said, "I don't want to go, sissy," which is what she called me. And I said, "Okay, you can stay, but we need to establish rules now." And I said, and number one, you will never act that way in public again. And she never did. And number two, and this set the boundaries for our relationship. I said, I have to be your parent first, then your sister. And one day when you grow up, I really hope I'm your friend. And she said, okay, got it. Parent, sister, friend. And that established the blueprint for our relationship.
What a strong 21-year-old you were. I mean, to know how important it was. Many parents, regardless of their age, don't know the importance, never learn the importance of creating that kind of safety, even when it's tough. It's really tough to have that framework, those strong boundaries, and to follow through so that the kiddo knows, regardless of what age they are.
I think I learned it because my parents didn't do it. So,
well, isn't it lovely when we can learn, without shaming or blaming our parents, learn from what they didn't do well and create something that's an improved version. So,
exactly.
what a way to begin that journey. And it also sounds as if maybe some reason she was acting out so early on was how difficult it would be to lose your mom overnight, even if your mother wasn't necessarily acting like a mother, but to lose that even false sense of safety and stability.
Absolutely.
Yeah.
And our mother didn't tell her. Our mother would not actually tell her. I had to tell her.
Oh my God, what a shock. Oh, so now let's move forward, because as from what I know about you and your story, I mean, you are a storyteller, you are a writer and so gifted at it. And this topic is incredibly nuanced and painful. So I would rather you guide the way on this one because, I don't, well, I have a question for you.
Go ahead.
When I think of the people I've lost to cancer, three who I love dearly and lost all three, um, can you tell me, as a psychologist, and I tell people that we never stop grieving when we love someone, we never truly, and that's the grief gets softer, it laps at our feet less, but, like waves coming in, it's not overwhelming us, but it's there. But I've never truly ended the grieving cycle, and I don't necessarily know that I would want to, because when it comes in, when it does every now and again, it's a reminder of the depth of that love. What do you think? How was that experience for you?
I think it depends on the relationship. So
Mm.
I've lost 7 family members to 5 different cancers now.
Oh my God.
And I'll take the very first loss was my paternal grandfather when I was 7. I barely remember him. I mean, I do remember him, and I remember what he smelled like because he smoked Lucky Strike, I think it was, cigarettes, and
Mm-hmm.
he called me Andy, and he's the only person who ever gave me that nickname. But I was 7 when he died, and the most, memorable thing was really the funeral itself and what impression that made on me. So I think it depends on the depth of the relationship. But I do agree. I don't think grief has a timeline or a right or a wrong way. And yeah, it ebbs, it flows. And I know for me, I didn't experience anger when Adrienne was diagnosed or throughout her cancer journey, because I didn't know who to be angry at. And so I didn't, it just didn't work for me. And about 17 years after she had died, I was watching this dumb show on Netflix of all things. And they got canceled at the last minute. So they had to do an episode where they just wrapped everything up. The whole storyline had to wrap up. So the youngest or the oldest daughter, all of a sudden they were showing her graduating from high school and then college and then this and then that. And I exploded. I was so angry
Oh,
for about 3 to 5 solid minutes, just infuriated. This fictional character on the screen got to do all these things that my sister didn't get to do because she loved school. She was looking forward to going to college. Like she had all these big dreams. And I was kind of shocked afterwards, like, wow, like where did that come from? So I totally agree with you. You just don't know. But yeah, the loss is a loss.
absolutely. And I agree with you on the part, I agree with all of it, but especially it's the depth of the connection, the depth of that love that you felt, that connection. And so if it's someone you know peripherally or only for a bit, you wouldn't necessarily feel that heavy, saturating loss that comes with someone that you've known for a long time and had a long, loving relationship with. So thank you. When you look at, if you don't mind telling us a little bit about your book.
Sure. So I wrote Better Off Bald because of all the cancer memoirs I had read. I was really dissatisfied by how the hard stuff was glossed over.
Mm.
And I didn't want to gloss over the hard stuff. And I kept a medical diary the entire time Adrienne was sick. And she was also a really prolific writer herself. So I structured it like a journal. So day 1 is chapter 1, and flashbacks fill in the 7 years before cancer entered our lives. So it really is this 7-year period in my life, but the plot is along the lines of her cancer journey. And by day 3, the chapters open up with a quote from her during that time. And so you really get to see what a different perspective she had as a patient versus me as her primary caregiver, her parent, and her sister. And there was one point where I thought she was getting better, and she actually knew at that point she was going to die, and she didn't tell me.
Oh,
So it really gives people, like I said, I don't hold back. I mean, I've gotten some criticism. There's some, I love reviews that say I'm a mean person, and I'm like, well, if advocating for my sister and what she wanted is mean, I'm mean. I'm fine with that. No problem.
For once, I'm speechless. That's hard. Mm, wow. I'm not certain why the reviews would be negative when all you're doing is being honest and straightforward. Um,
Oh, it's just I think it's people who haven't been down that road yet. They haven't had that kind of experience. They don't know how hard it is to stand up to the medical establishment and fight for what your loved one wants. And I tell caregivers all the time, it's not your job to be liked. Let them like your loved one, your patient, your spouse, whomever it is. That's not your job. Your job is to stand up for what the patient wants so they can focus on getting well.
Absolutely. Absolutely. And it is sad because the way our system is, sometimes the person who is in the most pain, suffering the most, the patient, they can't advocate for themselves. They're
Exactly.
exhausted, they're scared, they're not Googling next steps. They're lucky sometimes if they can put one foot in front of the other. And when the medical community is supposed to be benevolent and wise and kind, sometimes they just are jumping through the hoops that they feel are appropriate or whatever they're accustomed to. And I've been in that position of being that advocate. And the advocate, once I was almost forced out of the emergency room because the physician didn't like that I wanted them to review the medication the person was on that landed them in the emergency room because it was, causing hypotensive incidents, which is one thing if you're young, another if you're older and not young and don't have all of the resources. And it's that part. And if a dear friend of mine, when she was suffering from cancer, she's now gone, she asked me to go in and be her advocate because she didn't, and she was a strong, ferocious woman, but she had so little strength that I
Yeah.
had that responsibility, that privilege of going in with her and being her advocate. And not everyone is that lucky to have an advocate. And it's not an enviable position.
No, it's
People
not.
like you, it sounds like you and I, our set point is kindness and gentleness. We don't want to have to, get tough. But that's the hard part about medical systems. You almost always need to have an advocate, or the community often takes, the medical community will take the path of least resistance. I'm not saying everybody is like that, but
I agree. I totally agree. It was funny. Some of the nurses who really liked us would tell me privately, and this was first 2 weeks at Children's Hospital Los Angeles. They would say, everyone loves Adrienne. They think she's so funny, and she came in with her blue hair and all this metal jewelry, and she's cracking jokes. And they're like, but a lot of them don't like this. They called me the sister because I asked too many questions and things like that. I'm like, okay, who cares? I don't care. I love that they like her. That's great. They don't need to like me. Again, not my job to be liked.
absolutely. And one of my favorite phrases, asking questions.
Mhm.
And I'm a firm believer that asking questions is a critical element of life. When we stop asking questions, not manufacturing questions just to get attention, we're not talking about that. We're talking about coming up with questions that help you understand the process, help you hold people accountable, maybe have people look at another perspective. And we should all, I'm usually very judicious with my use of the word should, but in this case, I believe we should all be able to ask questions. And if somebody on the other side isn't able to tolerate the questions, which are a key part, especially of a medical journey, wanting to understand, wanting to have safety and security about this difficult process, if they can't tolerate questions, that says a lot about who they are.
Absolutely. Yeah. Ask questions and demand answers. And even if in, let's say in the medical situation, the doctor says, I don't know the answer, that's an answer. That's
Yeah.
an honest answer. And the best doctors, the ones that I know so well now, they're not afraid to admit if they don't have all the answers. They're not afraid to brutally honest about it. So yeah, I think it's critical, right?
Absolutely, that not knowing. I learned that lesson, gosh, back in college when I was doing student teaching to get my teaching credential. And I was in a class with 30, I think it was about 30 gifted third and fourth graders. And I had complete humility. I would just, most of the time, you have these 30 intelligent brains coming at you. I was like, I don't know. Let's look it up. I don't know.
There
Let's
you
look it up.
go.
And I've carried that with me, that gift of being able to say, I don't know. Let's look it up. And to me, that is a sign of both intelligence and wisdom, is being, it's okay, especially when you're thinking about something like what you encountered with your sister's cancer. For a clinician, a doctor, to be able to say, I don't know, but maybe we can dig up some research on that. I don't know, but I'll talk to this other specialist I know. That gives comfort. It gives security. It adds genuineness to the relationship. So thank you for sharing how important that piece is. It is a critical piece. And I also like how you painted a picture of your sister. Is that where the name Blue Fairy came from? Her blue hair, or is it something else?
It did. It did come from that. So I wanted her name as a tribute to her, and I wanted liver cancer in the name so people knew what we did. But my background is writing and marketing and teaching, and I felt like something was really missing from a branding perspective. So I sent an email out to all of my friends who were sort of like her aunts and uncles. None of them had had children yet, but they were around. And I asked them, what's missing? And every person came back with some version of Blue Fairy because blue was her favorite color. And I wouldn't let her dye her hair until she was 14. And then she dyed it blue, red, purple, blue again. I mean, so when she went into the hospital, she had blue hair that was fading. It was kind of like a teal at that point. And she loved fairies. And the summer she was sick, she bought this pair of blue butterfly wings, and we called her our Blue Fairy. And she was actually buried in those blue butterfly wings. And she bought a blue wig to maintain her look, as she said. And yeah, that's how the name came about. So
And you have it looks like the old English, the British spelling of fairy.
we do. That was the spelling she preferred.
I like it, Faery. That's
Yeah.
beautiful. So, in your work as an advocate, what do you do? What is your purpose, your goal in giving people support around cancer, specifically liver cancer?
Well, I run the organization, and I have, counting me, a team of 6 full-time employees.
Mm.
So I wear a lot of hats, but thankfully I'm getting a lot of stuff off my plate as well. But my overall goal is I want to see a cure for liver cancer in my lifetime. But in the meantime, I want people who are diagnosed with liver cancer to understand what all their options are, to make the choices they want to make, to make sure they're seen by someone who's a specialist. That was a challenge we faced even 20 years ago. Was the very first oncologist was a pediatric oncologist, and my sister did not have a pediatric type of liver cancer. She had just the most common type there is, and so we got a second opinion, and it took forever, but we finally actually transferred her care to UCLA with a doctor who saw her cancer every single day. He was a specialist in that cancer. But just more than anything, I want patients and their families to have a really good quality of life and to know what that means. So that's what I'm most proud of is
Mm.
patients and families coming, especially to our community or to our events, and just learning ideally how to prevent liver cancer, because while it's one of the deadliest, it's also one of the most preventable. But if they already have liver cancer, to really fully understand what all of their options may be.
Okay, so I'm learning today. I didn't know that about liver cancer. What are some key elements to liver cancer prevention? I didn't know it was one of the most preventable cancers. Please share.
Yes. Liver cancer primarily has sort of 3 buckets, 3 causes, if you will. And the first one is viral hepatitis, so chronic hepatitis B, um, which is transferred through skin contact, through bodily fluids, and hepatitis C, which is only transferred from one person to another through blood. Those are underlying causes. Now, not everyone who has chronic hepatitis B or hepatitis C will get liver cancer, but they are at extreme risk for it. So if you know you have either one of those, then you should be under what they call surveillance for the rest of your life. so you can prevent it, so you can get it, so you can catch it early. And it really depends on what part of the world we're in. But for example, hepatitis C is more common in Western countries. It used to be the most common cause of liver cancer in the US, whereas hepatitis B is more common in Asian countries and sub-Saharan Africa, because they don't have access to the hepatitis B vaccine, which we do. So there's that viral hepatitis. Then there's environmental, which they don't fully understand, but they know some things are linked to liver cancer. So there's a fungus called aflatoxin, which is common in foods in parts of Asia, but not here. And they know that there's some kind of link, but they don't know exactly what it is. And then the third bucket is lifestyle. And your liver, it's our detoxifier. Please don't ever order a liver detox on Amazon, because that's your liver's job. That's what it does. And this is where we're seeing the biggest challenge now, because it really used to be hepatitis C was the most common cause. Now it is obesity. It's fatty liver disease. Okay. Again, not everybody with fatty liver is going to get liver cancer, but you're now at extreme risk for liver cancer if you have fatty liver disease. And there's a lot that's not understood about fatty liver. Not everyone who is obese, for example, has fatty liver disease. And not everybody who has fatty liver disease is obese. So there's a metabolic component that they're studying now to try to better understand. But those are the three main buckets. So viral hepatitis, environmental factors, and lifestyle choices. And of course, alcohol is the one I think most people know. At least when my sister was diagnosed, that was the only thing I knew. Of course, drinking excessive alcohol can lead to liver cancer.
Absolutely. And research tells us, I'll use this as an opportunity to remind listeners, no alcohol is the best amount of alcohol. The old stats about a few drinks a day is good, that was funded by companies that had a lot to gain from that research coming out in that way. And we now have research that really reminds us that no alcohol is the best amount of alcohol. So,
yeah. And coffee, though, is very good for your liver.
Oh, excellent. That's good news.
Yeah, isn't that fun? Even
helps.
decaf. Coffee is very good for your liver.
Excellent. That makes, I wonder if lattes fall in that basket. That latte. I don't know. I'll have to think about it. So now I have a question for you. Feel free to say you don't want to answer it. Because you mentioned that your mom used drugs, was that part of what led to your sister getting liver cancer?
Yeah, they were stunned when they saw what they did in her biopsy. And they came out, and Adrienne was still in recovery and not awake yet. And they said to me, why do you have custody of your sister? Tell us about your mom. And I'm like, okay. And because I hadn't even brought in the guardianship papers yet. I mean, things were moving so fast. And I told them, and they said, okay, well, that makes more sense. And they said, did you know your sister has chronic hepatitis B and hepatitis C? And I was like, no. I only knew what hepatitis A was, which is hepatitis A is transmitted through food and water, contaminated food and water, and does not lead to liver cancer. You just feel really sick for usually a month. Just feel really bad. But so I got a Grey's Anatomy, the book, not the TV show, and a medical dictionary. And I immediately started looking things up, and I started with hepatitis B and C. And I was like, what is this? And the doctors concluded, based on our mother's drug history and the fact that she was a nurse. The year my sister was born was 1986. And so they did not test mothers prenatally. It was not standard care to test mothers prenatally for hepatitis B. Hepatitis C had not even been identified or taken out of the blood supply yet. So just because of the timing of my sister, our mother's background, they concluded that she got hepatitis B and C from our mother during childbirth, which is called vertical transmission. And it was just like the perfect storm. And the challenge with hepatitis B and C, even though it's a very simple blood test to find out if you have it, you don't know. You won't know until your liver starts to run down and become cirrhotic or turn into liver cancer. And my sister had no signs except for she had right shoulder pain 2 weeks before she was diagnosed, which is a sign of advanced liver cancer. Don't want to scare everybody. It's It's a very specific type of pain, but there's a nerve that runs from our liver all the way up to our right shoulder. And she had some acid reflux, and that was it, which is a common sign of any kind of GI cancer. But she was a teenager, and I couldn't control what she ate outside of our home,
Sure.
So I was like, stop eating tacos at school, just stop. But she didn't really have any symptoms until it was too late.
So, what were the first symptoms other than the GI, the acid reflux and the shoulder pain? What led you to take her into the
Just
doctor's office?
I came home from work I was teaching. I came home on Wednesday, May 16th, and usually she would be sitting in our kitchen doing her homework, another rule in our house. And she went to high school from 7 to 2, and I typically taught from 8 to 3. So, I walk in, I'm looking for her, and instead of at the kitchen table, she's lying on the living room floor, curled up in a fetal position, saying she couldn't breathe, and just clutching her right side, exactly where her liver is. Now, mind you, the day before, 100% fine. I mean, totally fine. The only thing had been the shoulder pain. So we went to her pediatrician. He thought we were back because of the shoulder pain, which it's not his fault. He misdiagnosed it, but he did. And her liver was distended. And he said, well, excuse me, her abdomen was distended. And he said, well, how long have you been swollen? And she said, oh, a couple of days. And I felt guilty, but I didn't know because I was a very fortunate parent and she didn't wear skimpy things like all of her friends did. Like I never had to worry about issues with school and clothes because she just didn't dress like that. So she hadn't told me that her stomach had been swollen a couple of days, but it was. And so we immediately he sent us to the ER, and it was the ER doctor who told us that she had tumors in her liver and lungs. And then we were immediately transported to Children's Hospital Los Angeles by ambulance.
Tumors in her liver and her lungs. Did I hear
Hmm.
that?
Yeah, it had
I
already
am so
metastasized.
sorry.
Yeah,
Wow. I am sorry. I'm sorry for that journey. I'm sorry for her. I'm sorry for you.
thank you.
Oh my goodness. Again, speechless. I am so sorry. I can't even imagine seeing your child on the floor, in pain. Wow. So, shifting for a moment, please. What
Sure.
when you think about our listeners, I'm moving to safe ground here where I
Hmm.
could get my response under control, take a deep breath in, deep breath out. Can you tell our listener, the one who wrote in,
Hmm.
who's feeling this sense, because it sounds like this is where you're working, you're teaching full time, and now in a blink of an eye, you've become a caregiver of somebody with stage 4 liver cancer. How did you manage all of that?
Well, I think, yeah, I would love to speak to the listener specifically. I think my situation was very different because I was the parent of a minor child. I got to make all the decisions. Well, that's not entirely true. Adrienne made a lot of decisions, um, but including refusing a chemotherapy drug after it caused some hearing loss. But I think it was a very different dynamic, right? Rather than, if I remember correctly, the listener saying this is her mother, right?
Yes, her mother.
She's mother, only child,
Father not in the picture. It
fathered on the picture.
sounded like
Um,
she was trying to balance work, mom, and just trying to stay
yeah,
afloat.
you have to find support, right? I mean, that's the key to any type of resilience period. You have to seek support. So, even if she's the only child, you've got to find some outside support. And obviously, it can't be your mother. It has to be someone else. And it can be friends, it could be family, it can be professional support. I mean, my sister had been seeing a therapist for 2 years, and we didn't stop that. The only difference was her therapist either came to the hospital or came to our house. But that was something my sister really needed. That was support that she wanted to continue. I probably did not seek enough support. I mean, I asked, but just nothing existed for parents at that time. Nothing was around, even at Children's Hospital. I'm like, where's the support group for parents? We're all here. And there wasn't anything
That's
like that.
unbelievable that there was
Yeah.
no support.
There wasn't. The other thing I would definitely recommend because this gets underutilized with adult cancer patients is talk to your mother's social worker and ask about other types of support services. For example, I mean, if your child has cancer, you automatically have a social worker involved. Like that's an automatic thing
Okay.
at any decent sized cancer center. That's just an, but with adults, there are social workers available, but often that information isn't shared with the patients and their families. It's really strange. So I would ask about other support services. For example, my sister's best friend's mother did this research and said, "Hey guys, I think you qualify for this program," because I ended up quitting my job to take care of my sister full time.
Oh my
And
goodness.
and it was a state-run program and we did qualify. And so we ended up getting some more financial support from the state since I was her primary caregiver and she had cancer. Um, so there's that type of support as well. But I think it is really important to take care of yourself. And I didn't do a good job of that, I will say. But it's very, very important to take care of yourself. But I also like that your listener talked about anger
Yes.
because anger is not a bad emotion. And as I said earlier, I didn't feel angry for so long. And I don't think I was suppressing it. I mean, I just didn't feel it. But anger is healthy. Anger means you're not in denial. Anger means you're in the present, you're in the moment, and you have every right to be angry. Of course you do. Of course you do.
Absolutely. And thank you for bringing that up. Often we hear about the negative emotions and the positive emotions, and I probably use those terms at some point and have learned over time that all the emotions are good. They are all healthy. It's how we use them that can make a difference between healthy and unhealthy. But when anger
Exactly.
comes up, it's a messenger. It's telling us, just like when you were talking earlier about watching the show and all of a sudden
Yeah.
anger came up. It knew. It was like, I was imagining, I don't know if this is what came up for you, but I was imagining seeing all of these steps in life that your sister missed, all of the
Yeah.
hopes and dreams that were missed, that didn't come to fruition. And so anger, it's a good, and it's interesting how the listener didn't use the word like sadness. And I think that sometimes sadness can't seep in yet when you're trying to manage too much.
Yeah, I lived in a very healthy state of denial because that was the only way I could get through it. There, I could not imagine a world without my sister. I could not imagine that kind of loss because I've never ever loved anyone the way I love her. I
Oh,
mean, and still love her, so deeply and so unconditionally. I've never loved like that. And yeah, I just couldn't imagine it. I will say kind of two things, two sides of a coin. Don't grieve while the person's still alive, because I've heard from patients how hard that is for them, where they feel like they're already being treated as if they're gone.
yes.
And it's of course it's never intentional or rarely intentional, but don't grieve the loss, before the loss. But at the same time, when the loss happens, don't hold back on grief. Man, let it go because the first year after Adrian died, I was trying so hard to be what everyone wanted me to be, to go back to being Andrea. And I was just faking it. And I was deeply depressed. I was deeply suicidal. And no one really knew. Only one person realized it and called me out on it, thankfully. And I'm glad he did. But I was just trying so hard. And I think part of it was I was like, I am forever changed. And does that mean I'm now going to lose my friends?
Mm.
And I did. When I finally a year after she died, when I fully embraced my grief, when I fully just let it happen, and at that point it had built up, I lost all the friends I had, not all at once, but over time. I lost all the friends I had because I'm never going to go back to the person I was before she died or before she was diagnosed. Like that's just not going to happen. I feel like core me is still here, but you find out who your friends are. That's the truth. You find out.
Absolutely. Life's challenges do let us see who steps up and who fades away. And
Yep.
no shame, no blame. It just really lets you see who's in your court. And
Yeah.
it sounds as if, especially when you got to the point of being suicidal, and only one person, thank goodness for that one person,
Yeah.
they were able to recognize it and give you support, I'm guessing you got support from them in a really strong,
In a rudimentary way, yes.
in a rudimentary is better than nothing, I guess.
But it's what led to me founding Blue Fairy because I realized I had to channel my grief. I had to find a way to turn it around. And I wanted to volunteer for the largest liver disease organization in the US, but they wanted nothing to do with liver cancer. They had no interest in it. It wasn't even on their website. And I think they thought I wanted a job, but I made it really clear, like, I'm not asking for a job, but here's my background, and you're missing liver cancer, and liver cancer is only going to get worse. And it is really never declined. It's gotten worse worldwide since my sister died. And I could see that trajectory, and nobody was doing anything in liver cancer. So we're still the only nonprofit that I know of that's specifically focused on HCC. There are more liver cancer nonprofits now that are focused either on other types of liver cancer or liver disease more broadly, but there wasn't anyone doing anything in liver cancer.
Well, thank you so much for your hard work. And just this morning, I was listening to a segment where they were talking about now, for the first time in today's world, there are more obese children than there are children who have malnutrition in the
Oh my
world, which
goodness.
tells us, with the piece you brought up, the connection of fatty
Oh,
liver to
yeah.
liver cancer. It's something for all of us, parents.
Isn't that just devastating? That's
Oh,
devastating.
it's frightening, and it's something we can do something about.
Yeah,
We can eat clean, we can keep away from processed foods, we can exercise, we can move. That's the part about, the obesity connection. The
yeah,
other connection, like what your sister suffered from, that's more nuanced, especially if you're,
right,
living in a household where there's drug use. And
right, right.
again, I'm sorry. When we look, one more thing about this listener's question, and you talking about the critical nature of getting support for her. I am also a firm believer in support groups. And I know there are meetup groups out there, sometimes a community health center, a local junior college or university might have some sort of support group. There are also, I don't know the age of her mother, but I know that for seniors in many communities, there are senior support services that can
Yeah,
bring in meals, that can do some
exactly.
errands. So I think sometimes thinking outside the box is what we need to do. Yet when you're already overwhelmed, that sounds so easy. Oh, just think outside the box, do some phone calls, But when you're already feeling depleted, those steps can be very hard to take.
Yeah. What I found helpful to do was when someone would step up and say, "Is there anything I can do?" Because people do genuinely want to help, but they're not going to know what to do if you don't tell them what to do. And I had someone, many people, but this one person in particular was not a close friend of mine, but she had met Adrienne. We had done a play together, and I was like, "Yeah, there is something you can do." And because I realized she lived right next to a store where Adrienne wanted something in Hollywood. And, LA, the traffic is no joke
No
whatsoever.
joke.
And, I was just going to do this errand myself, but it would mean leaving Adrienne alone, and it would take like 25 minutes to get there. I mean, I was going to be gone like an hour and a half easily. And I rarely left her alone. And so I said, "Yeah, Tess, there is something you can do. And would you mind going to this place and getting this stuff and bringing it to our house?" And she was like, "No way, no, absolutely, it's fine." And she did it. So it was just a one-off thing, but I think that if you can sort of make a list of what would be helpful, whether it's groceries. I know one patient, like a friend, would always just come get her car and put gas in it. So her car always had a full tank of gas. It can be really little things like that that make all the difference in the world for the family.
Thank you for highlighting that. And I can see it coming from both ends. The person who's in treatment and their family, if somebody says, hey, can I support you? And I love your idea of having a list at the ready. It can be something as simple as, would be great to come home and have anything in the fridge. Any home
Yes.
meal would
Yeah.
be much
Yeah.
appreciated. Thank you. Or I haven't had time to do this research on the upsides and downsides of this treatment that they're proposing. Could you, and especially there are some people like me who love doing research. So if you give it to someone, so being okay asking, it's okay. And then if you're on the other end, friend, family, or somebody who's looking to, do some good deeds in the world, even if, as you say, even if you know someone peripherally, just showing up and saying, I'm here, I have an extra 3 hours this week. Would you like me to, cut the grass? Would you like me to tend to your flowers? Would you like me to pick up some books at the library? What would you like? And so when we do that, not only are we taking care of ourselves because it feels good to donate and do good things, but we're also taking care of those people who are often desperately in need, and one foot in front of the other is all they can do.
Exactly.
Oh my goodness, you are such a gift, and I am so grateful for the work that you do. I'm so grateful for your passion and commitment, and my goodness, the way you honor your sister every day through what you do. What a blessing it was for her to have you and you to have her. So thank you.
Yeah, it definitely went both ways. Yeah.
Do you have any other insights for our listeners, or the question of the day, the person who wrote in? Any other thoughts?
I would say this was a piece of advice I got in college that at the time I didn't appreciate. But I think it also can really, really help families and patients. Don't confuse who you are with what you do. And because what you do can change. So right now you might be somebody fighting cancer, and it's okay to not identify as a cancer patient, just to say, hey, I'm someone who's fighting cancer right now. This is something I'm doing. It's not who I am. It's not the whole of my existence. And I think that is where doctors really struggle at times, because they don't often see the person, they see the patient. And I just love the people who stand up to them and say, no, 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 I am a person living with cancer. But that is not all of me. I am all these other things. This is who I am. That's just one thing. So yeah, don't confuse who you are with what you do.
Thank you for saying that. And as you were speaking, I could feel anger coming up in me as you were talking about I listened to my anger. I was having a conversation with someone the other day, and they were saying how there are certain parts of the medical community where they don't even call patients anymore. They call them cases.
Oh, God.
If somebody is that removed from the human being that they are entrusted to care for, if all they see is a case, they should not be, this is my personal opinion and my professional opinion as well, they should not be in a position of caring for a patient, for the human being behind that patient. It's part and parcel of being a caregiver. And that's what the medical community, as I am entrusted with being a caregiver. And we need to take that seriously, because the person on the other end of that situation is often in great pain, and you need to be them, and confusion and all of those things. So thank you for saying something that brought up my anger. I like listening to it. So thank you so much for your expertise, for sharing your story and your wisdom, and all about your gorgeous nonprofit that is doing so much good and spreading awareness and wisdom about liver cancer. And again, I'm sorry for your loss. I am grateful that you allow your sister to live on through Blue Faery. It's so beautiful. And where can our listeners find more about you, your book, your nonprofit? Of course, it will all be in the show notes. So listeners, if you're driving, just look in the show notes, but please do share.
You can find me at AndreaWilsonWoods.com. And as far as social media, I'm most active on LinkedIn. And Blue Faery at BLUEFAERY.org. So it's just fairy with an E instead of an I. And my book, betteroffbald.com, available wherever you get books, and also available if you have Amazon on Kindle Unlimited.
Well, thank you again so much for all of your sharing, your love, your wisdom, everything. So it's been a true pleasure and an honor. Thank you.
Thank you for having me.
And thank you to our listeners for sharing in this very poignant journey with us today. I hope you have some really good takeaways for self-care and care for others in your life. So thank you again. And this is Imperfect Love.
Thanks so much for sharing your time with me today. Remember, you have the power to transform your life and love fearlessly, if imperfectly, and it's my privilege to help you along the way. You can find more life-changing content, including my books and other podcast episodes, at drcarlamanly.com. Feel free to submit your own confidential questions through my website. I'll do my very best to include your issue on a future episode. If you found this podcast helpful, please subscribe and leave a review. Until we connect again, this is Dr. Carla Marie Manly wishing you oceans of blessings and love. Please note, this podcast is psychoeducational in nature and is not intended to replace formal mental health support. Please contact your healthcare provider or emergency hotline if you need psychiatric care. And, as always, please take good care of your amazing, wonderful self.